Good morning, students. Today I will introduce newly topic in this syllabus of your community health nursing, that is mid-level health provider. In a short form, MLHP is there, and you can say community health officer. So regarding the introduction, as a part of Ayushman Bharat Health and Wellness Centers, the community health officers are a new cadre of non-physician health workers. You can call them non-physician health workers also. So this is a new post introduced after the launch of Ayushman Bharat, which is health and wellness center. So community health officer will play a critical role in provision of expanded range of essential package of services as a part of comprehensive primary health care. So in this community health officer, they play a very critical or important role, and because they provide wide range of the necessary services package to the needful person of the community persons. And CHO, they are expected to lead the primary care team as a sub centers. Health and wellness centers provide clinical management and ambulatory care to the community and serve as an important coordination link to ensure the continuum of care. And there are serve as a coordination link between the primary health centers or a medical professions and also local community, which comes under that particular sub centers. Okay. Next is, who is CHO, community health officer? Individuals with professions background such as bachelor in community health or a nurse, GNM, BSc, post basic BSc, or an Ayurveda practitioner trained and certified through IGNOU, other state public health or medical universities, and posted at sub centers and health and wellness centers for leading primary health care team. Those persons who has background with the professions of like bachelor in community health and nursing professions background like GNM, bachelors with nursing, and other persons background like Ayurveda practitioners, and trained or certified persons via IGNOU and other state public like health and medical university, and also those who are posted at sub centers and health wellness clinical centers, and also dealing with the primary health care team. Next, here I am telling you that how many members are working in their setup. There will be one CHO, that is community health officer, and two female, one ANM, and one multipurpose health worker, and or maybe there will be one female ANM or a multipurpose health a multipurpose worker, or one male from MPW. And the next member is one ASHA worker for 1000 population. So this all about are member of the sub centers or wellness centers. Now next is objectives of the community health officer. First is improve access to healthcare in rural or remote area for the vulnerable families, those family who are poor and they cannot afford healthcare services. So therefore it's objective of the community health officers to improve their health in either rural or urban areas. Next is reduce out of pocket expenditure being occurred by families on healthcare. Those family pocket is not allowed to meet the health services, and then that time CHO is help to the poor persons with free. There is no cost for the healthcare services. Next, increase the utilizations of public health services at primary care level. So community health officers will increase the needful utilities or requirement for the public domain at the primary care level. Next, last is reduce workload of the secondary and tertiary care facilities. And here community health officers aims to reduce the secondary or tertiary care facility because they are trying to provide the necessary services at the primary level, and public can take the health services at the primary level. Next, we are discussing the role and responsibility of the community health officers. As community health officers, will the first point of care sources of information for the health related issues for the community, and by the virtue of the proximity of health and wellness center to its catchment populations. So, community health officer is the first person who will give the correct information related to the health issues to the community people. Community health officers are broadly expected to perform the following three functions. There are three main and broadly functions for the community health officer. First is clinical functions, second public health functions, and last is managerial functions. Here in clinical functions, community health officers will give outpatient care and management to the community areas people. And in second public health functions, here community health officers also will promote the health and prevent and surveillance of the occurred disease. Last is managerial function. In managerial functions, community health officer will do work as an efficient manner